We will talk about hypertension, early signs, and how to detect it at the earliest stages. We will also discuss what happens if it is left untreated, and how to treat or avoid hypertension. High blood pressure and the diseases associated with hypertension are the leading cause of death worldwide. Hypertension refers to high blood pressure, and it affects 40% of the world's population after the age of 40. The risk of hypertension increases dramatically over time. By the age of 70, it affects almost 80% of the population. Hypertension is often called the silent killer. Because it usually has no evident symptoms, unlike common illnesses like the cold or flu, the disease can progress for many years without any noticeable signs. This is why the first and earliest sign of hypertension is a direct measurement of blood pressure. When the systolic upper measurement is higher than 130 millimeters of mercury, or the diastolic lower measurement is above 80, this indicates elevated blood pressure. According to some guidelines, a systolic measurement of 130 is considered high normal and not yet classified as hypertension. However, the main point is that 50% of such cases will progress into higher measurements over the years. Hypertension develops gradually and slowly. Over time, arteries lose their elasticity and become stiff. This usually happens because of chronic low-grade inflammation due to the buildup of free radicals. This inflammation leads to a process called vascular remodeling, where small arteries undergo structural changes, narrowing their lumen and increasing resistance. One of the strongest predictors of hypertension is obesity, or being overweight. If a person is obese, there is a 70% chance that they will develop hypertension. Excess body fat increases blood volume, raises blood pressure, causes insulin resistance, and activates the sympathetic nervous system, which further increases blood pressure. Additionally, fat cells release hormones like leptin and angiotensin, which contribute to higher blood pressure. Fat tissue also induces chronic inflammation throughout the body. The second important predictor is high sodium intake. People who consume large amounts of salt have a 60% likelihood of developing hypertension. When a person consumes sodium, it is mostly distributed into the interstitial space in the tissues. Salt automatically attracts water due to osmotic pressure, causing water to move from the cells into the interstitial fluid. This leads to dehydration of the cells, while more water accumulates outside the cells. This imbalance is detected by the brain, causing the person to feel thirsty. The more sodium a person consumes, the more water they retain in the body, which leads to swelling and blood volume overload, ultimately contributing to hypertension. Sodium also directly activates aldosterone, a hormone that causes further fluid retention in the body, exacerbating hypertension. In addition to increasing blood pressure, sodium can also cause leg swelling. The third most common factor associated with hypertension is a lack of physical activity. Physical inactivity leads to a less efficient heart, which must work harder to pump blood, leading to higher blood pressure over time. Regular physical activity promotes the production of nitric oxide, which relaxes blood vessels and causes vasodilation. This process decreases the resistance in blood vessels. A lack of nitric oxide causes blood dysfunction and narrowing, which can also lead to an increase in blood pressure. Almost 70% of physically sedentary people will have hypertension by the age of 60. One of the most common early signs of hypertension is a morning headache. This headache is usually not sharp and is often felt on both sides of the head, typically at the back of the head or forehead. People describe it as a sensation of tightness or a band-like pain. The headache tends to worsen with physical activity. Increased blood pressure causes mild swelling in the brain's blood vessels, which activates pain receptors, leading to headaches. Lying flat during sleep can also impair venous drainage from the head, further increasing intracranial pressure in individuals with elevated blood pressure, especially in the morning when blood pressure tends to peak. This type of headache is not specific to hypertension and can resemble a tension-type headache, but it is still common among those with hypertension. Another important sign is fatigue and tiredness. During hypertension, arteries become stiff and lose the ability to change diameter when needed, especially during physical activity. This can lead to early fatigue. Constantly elevated blood pressure places more strain on the heart, which also contributes to feelings of fatigue. In some cases, tinnitus or noise in the ears can be a sign of hypertension. Generally, this is not an early sign and is more commonly associated with long-standing uncontrolled hypertension, but occasionally it can be an early symptom. Increased blood pressure can affect the microcirculation in the inner ear, leading to vascular changes that may cause ringing or buzzing sounds. This is particularly noticeable in cases of fluctuating or elevated systolic pressure that affects blood flow to sensitive structures in the ear. Another early sign of hypertension can be anxiety and restlessness, which occurs in about 20% of individuals with early hypertension. This happens because elevated blood pressure activates the sympathetic nervous system, leading to the release of adrenaline, which causes symptoms such as restless and mild anxiety. Other strong associations with hypertension include chronic stress, smoking, and alcoholism. Genetics is also a strong predictor. If a parent has hypertension, there's almost a 50% probability that their children will develop hypertension later in life. While genetics are a strong predictor, environmental factors such as diet, physical activity, and lifestyle also significantly influence whether someone with a genetic predisposition develops hypertension. What we discussed earlier refers to the most common type of hypertension, which is called essential hypertension. However, different diseases can also cause hypertension, known as secondary hypertension. In cases of uncontrolled hypertension, a person has almost a 70% chance of having a myocardial infarction later in life. This is because hypertension causes damage to the arteries and leads to atherosclerosis, eventually narrowing the heart's blood vessels and causing a blockage that results in a heart attack. Stroke is another important complication. Hypertension increases the risk of stroke by 5 times. Untreated hypertension also significantly increases the risk of heart failure, kidney disease, aneurysms, and vision loss. Almost 30% of people with hypertension will experience some degree of vision loss due to hypertensive retinopathy. Now let us talk about treatment. The goal of treatment should be to maintain blood pressure below 130 mm of mercury or below 140 for older adults over 65. The first line of treatment for hypertension includes a CE inhibitors or angiotensin C receptor blockers such as lisinopril or losartan. These medications reduce vasoconstriction and fluid retention by blocking the renin-angiotensin system. They are effective and importantly reduce the risk of heart failure, stroke, and kidney disease. Another commonly used medication is calcium channel blockers, such as dilsum and amlodipine. They relax blood vessels by blocking calcium influx into smooth muscle cells. They are particularly effective in adults, especially those with isolated systolic hypertension. Another class of antihypertensives are diuretics like hydrochlorothiazide and clothalidone. Their mechanism involves increasing sodium and water excretion by the kidneys, which reduces blood volume and lowers blood pressure. When combinations are used, a very common combination is lisinopril plus amlodipine. Together, they have a synergistic and powerful blood pressure lowering effect. Another common practice is combining angiotensin E receptor blockers with azide diuretics such as losartan plus hydrochlorothiazide. The main side effects are, for CE inhibitors, cough and angioedema. They can sometimes cause hyperkalemia. Calcium channel blockers can cause leg swelling, headaches, and in some cases constipation. Thiazides can cause hypokalemia, hyponatremia sodium, hyperuricemia, which can exacerbate GOLD, and elevated blood sugar and cholesterol levels. In younger patients, treatment usually starts with lisinopril or losartan. In older adults, treatment often begins with amlodipine or thiazide diuretics. If a person has kidney disease, ACEA inhibitors are preferred. In cases of heart failure, ACEA inhibitors or beta blockers are used with hydrochlorothiazide. For patients with diabetes, ACA inhibitors or angiotensin receptor blockers are preferred. For blood pressure up to 140/90, lifestyle changes alone can be enough if the patient has no risk factors for diabetes, heart disease, or kidney disease. In stage 2 hypertension, where blood pressure is 140 or more, or the lower measurement is 90 or more, medications are started alongside lifestyle changes. Among lifestyle factors, a low sodium diet, regular exercise, and weight loss are the most important for managing hypertension. Most of the medications mentioned above are taken once daily.